Welcome to the Community Health Worker Instructor course. This course will prepare you for certification as an instructor in the state of Texas. Please remember to turn off autoplay in the upper right-hand corner of your screen so you won't feed into the next video. Let's begin. This video is about the social determinants of health, where you live, learn, work, and play. The video will assist you in becoming familiar with the social determinants of health, social versus physical determinants, how social determinants impact health, an example of how community health workers can play an important role in regard to the social determinants of health. The social determinants of health are comprised of conditions, for example, social, economic, and physical conditions, in various environments and settings, for example, schools, churches, workplaces, and neighborhoods, and have been referred to as place. In addition to the more material aspects of place, the patterns of social engagement and sense of security and well-being are also affected by where people live. Resources that enhance quality of life can have a significant influence on population health outcomes. Examples of these resources include safe and affordable housing, access to education, public safety, availability of healthy foods, local emergency health services, and environments free of life-threatening toxins. Here you see Healthy People 2020's definition of the social determinants of health. Conditions in the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. Before diving deeper into social determinants of health, listen to a fictional scenario presented by the Los Angeles County Department of Public Health's report, How Social and Economic Factors Affect Health. A 22-year-old new mother is discharged from the hospital after delivering her baby, the full-term product of a planned pregnancy. Unplanned pregnancies in her community have dropped to historic lows since the health department demonstrated the impact of the high rate of teenage pregnancies on the health and well-being of young mothers and their offspring. In association with the public school system, effective sexuality education interventions have been implemented, and all high school students have access to school-based clinics and reproductive health services. This young woman's family took advantage of the SNAP food stamp program, which had added incentives for the purchase of fruits and vegetables. Collaboration among social services, law enforcement, and public health reduced street violence and substance abuse to low levels. This young woman received early prenatal care through a medical care system that guaranteed universal insurance. Although there were no local providers in her neighborhood, expanded bus service enabled her to visit a physician in the central city. Over the past decade, with grassroots and community participation, new bus lines were created, sidewalks added, and of several empty lots replaced by a new park and adjacent community garden, all of which have increased physical activity. The local public health agency successfully engaged transportation and public works to implement these features, and community groups and local businesses raised funds to help support these efforts. With early prenatal care, this young mother knew to avoid secondhand smoke. But there was less of that around these days because smoking rates have increased markedly in part due to a new ordinance banning smoking in multi-unit dwellings. She also ate well during her pregnancy. Her main meal of the day was at the cafeteria at the public university, where she is a part-time student. Her legislators have reallocated the state budget to increase funding for higher education, having been convinced that education increased healthy years of life and decreased utilization of medical care. The cafeteria serves fresh fruits and vegetables and non-processed foods. Fast food restaurants have been eliminated from the campus. Although she still enjoys fast food at the restaurant where she works part-time, the salt content of these foods has dropped an average of 8% throughout the industry, and fried foods have been largely replaced by grilled and baked choices. Public health efforts to educate the food industry and the wider public on the harms of salt have increased public demand for lower sodium products. In addition to public demand and a greater FDA and USDA oversight, Board members of the companies that make processed foods supported these policies to reduce rising employee healthcare costs and absenteeism due to hypertension-related illness. Along with her now vibrant community, good prenatal care, improved nutrition, and increased physical exercise enabled her to avoid preeclampsia. She had mild pregnancy-related hypertension that was well controlled, and she had an uncomplicated labor and delivery. Because the hospital was baby-friendly, she was taught the benefits of breastfeeding and was able to start breastfeeding her son at birth. Her expanded social network of friends encouraged her to delay her next pregnancy for several years, and accessible, affordable childcare will allow her to complete her education. This breastfed infant will have increased protection from infectious illness, a healthy start to life, and will grow up in a supportive, helpful community. Think about the story that you just heard and consider the social determinants of health examples that we'll talk about over the next few slides. Availability of resources to meet daily needs, for example, safe housing and local food markets, access to educational, economic, and job opportunities, access to healthcare services, quality of education and job training, the availability of community-based resources in support of community living and opportunities for recreational and leisure time activities, transportation options, public safety, and social support. Additional social determinants of health comprise social norms and attitudes. For example, discrimination, racism, and distrust of government, access to healthcare services, quality of education and job training, exposure to crime, violence, and social disorder, for example, presence of trash and lack of cooperation in a community, or socioeconomic conditions where concentrated poverty and the stressful conditions that accompany it are examples of social determinants of health. Residential segregation, language and literacy, access to mass media and emerging technologies, and culture all have an impact on the lives of the community members that surround them. Physical determinants of health include the natural environment, such as green space or weather, built environment, such as buildings, sidewalks, bike lanes, and roads, exposure to crime, violence, and social disorder, work sites, schools, and recreational settings, housing and community design, exposure to toxic substances and other physical hazards, physical barriers, especially for people with disabilities, aesthetic elements, and culture. When you think about all of these different elements that comprise social determinants of health, consider that by working to establish policies that positively influence social and economic conditions, and policies that support changes in individual behavior, we can improve health for large numbers of people in ways that can be sustained over time. By improving the conditions in which we live, learn, work, and play, and the quality of our relationships, will create a healthier population, society, and workforce. Hopefully, you have a little bit better insight into the social determinants of health and how these social determinants can impact the health of the communities in which we live. Let's talk a little bit more about a framework presented by Healthy People 2020 of the social determinants of health that are made up of 5 key determinants. Each of these 5 areas have underlying factors in regard to the social determinants of health. For example, economic stability comprises poverty, employment, food security, and housing stability. Education is an umbrella over high school graduation, enrollment in higher education, language and literacy, early childhood education and development. Social and community context involves social cohesion, civic participation, discrimination, and incarceration. Health and healthcare comprises access to healthcare, access to primary care, and health literacy. And the neighborhood and built environment involves access to healthy foods, quality of housing, crime and violence, and environmental conditions. Consider economic stability in the story A Better Path that you heard earlier in the slideshow. Poverty, employment, food security, and housing stability all have an impact on a pregnant young woman. And if those situations are alleviated, then it's easy to see how a healthy pregnancy can result in a healthier newborn. As far as education, the young woman had the opportunity to continue beyond her high school graduation and also pursue higher education. Language and literacy help as far as her abilities to pursue education. And there was also an opportunity for her infant with a spaced amount of time before her next pregnancy so that her infant would have appropriate early childhood education and development. In thinking about social and community context and the story that you heard earlier, social cohesion and civic participation all promoted a healthy surrounding for the young woman and made it possible for her most likely to avoid discrimination and certainly incarceration. Her needs were fulfilled and she was able to live a vibrant and healthy life. As far as accessing good prenatal care, she was able to navigate the care that she needed to maintain a healthy pregnancy and also to have an uncomplicated birth. And you'll recall also the neighborhood and the built environment that we talked about when you listened to her story. So there was certainly access to healthy foods, the opportunity to avoid crime and violence, and environmental conditions that supported physical activity. This is an example of a framework that's used in public health practice today. And you can hopefully see now how, in thinking of the story that you heard earlier, you can apply a framework like this to consider improving the conditions in which someone lives. So let's talk a little bit more about community health workers and how a real-world example of working with the social determinants of health impacted a community. A real-world example, a community health worker intervention to address the social determinants of health through policy change, is an article that was written by Ingram et al. In 2013 in the Journal of Primary Prevention that discussed a project called Acción para la Salud. Community health workers from 5 health agencies engage their community in the process of making positive systems and environmental changes. The diagram here helps you see a little bit about the different issues and problems that were addressed. And with community health workers working in each of these 3 areas, they were able to reach a consensus of a sort that could then promote policy change. As far as how they did this, community health workers documented community advocacy activities through encounter forums in which they identified problems, formulated solutions, and described systems and policy change efforts. Strategy maps described the steps of the advocacy plans that the community health workers worked on. The findings of this project demonstrate that community health workers worked to initiate discussions about underlying social determinants and environment-related factors that impact health, and identified solutions to improve neighborhood conditions, create community opportunities, and increase access to services. By using theories of community engagement and policy change, as pictured by this graphic here, the Acción para la Salud sought to empower community health workers and their communities to advocate for sustainable changes targeting underlying social determinants. So if you'd like to see a little bit more about Acción para la Salud, you can easily search online and find more about the training that surrounds this project. So in plain language, please think about where you eat, live, work, and play. Think about the following verbiage from the Robert Wood Johnson Foundation's work around the social determinants of health. The plain language message is appealing, and please think about this when you work with your communities as a community health worker, and how this way of communicating about it also addresses some of our work earlier in the course as far as plain language and literacy. America leads the world in medical research and medical care, and for all we spend on healthcare, we should be the healthiest people on earth. Yet on some of the most important indicators, like how long we live, we're not even in the top 25, behind countries like Bosnia and Jordan. It's time for America to lead again on health, and that means taking 3 steps. The first is to ensure that everyone can afford to see a doctor when they're sick. The second is to build preventive care, like screening for cancer and heart disease, into every healthcare plan and make it available to people who otherwise won't or can't go in for it in malls and other public places where it's easy to stop for a test. The third is to stop thinking of health as something we get at the doctor's office, but instead as something that starts in our families, in our schools and workplaces, in our playgrounds and parks, and in the air we breathe and the water we drink. The more you see the problem of health this way, the more opportunities you have to improve it. Scientists have found that the conditions in which we live and work have an enormous impact on our health, long before we ever see a doctor. It's time we expand the way we think about health to include how to keep it, not just how to get it back. To review, during this video, you learned about the social determinants of health, social versus physical determinants, how social determinants impact health, an example of how community health workers can play an important role in regard to the social determinants of health, and listen to a plain language explanation of the social determinants of health and how they impact Americans today.